Hello friends, I am homeopath R.S. Sani. Today we will talk about the children. How to recognize the particular homeopathic remedy when a child arrives in your clinic with the parents. We will deal with the personalities of two homeopathic remedies today, and then we will differentiate as to how to recognize each one of them in the presenting case. We will deal with phosphorus and sulphur children. So first, phosphorus. When a phosphorus child comes to the clinic with the parents, the children belonging to this remedy, they arrive in the clinic in a very approaching manner. They are very friendly with the physician. Some of the children will extend their hand to shake hands with the physician. And they will sit properly, they have proper manners and etiquettes, and they're very expressive in their demeanor. They are very lean and thin and have very attractive, sharp features. They have very defined large eyelashes and eyebrows. This makes them look very attractive and very well groomed and made up. They are very observant of the actions of the physician in the clinic. They are very watchful of their surroundings as well. Especially, they will be watching what the doctor or the homeopath is doing while he is taking up the case or talking to the parents or watching the child. The child in turn is watching the actions of the physician. In my clinic, I have seen when I take cases who belong to phosphorus, those children, when I finish taking up the history of the case and I move towards my preparation area in the pharmacy room, then they follow me after me. They come and they stand just by my side when I am preparing the remedy. They ask me many questions. They keep on observing, "Doctor, what are you doing? Doctor, can you take me in your lab?" Phosphorus children, they need contact. Phosphorus children are very diffusive. The phosphorus personalities, they are very outgoing and they're very extroverts, expressive, and they easily establish contact with the other person. They are very sympathetic and they're very affectionate at the same time. If you love them, they will return that affection many times more than the other person. And when such a child comes into the clinic, you feel like to have dialogue with the child because the child feels involved. The child feels as if he is a member of the family. He treats the physician as the member of his own family. Thereby, such children are very attractive and very, you can say, easygoing. They will not trouble you at all. They will present their good side of their personality, and you will have the tendency to lift the child in your lap and just play with him. Phosphorus children, when they arrive in your clinic, they have a pleasant demeanor on their face. They are not irritated at all. They look very happy. They look cheerful. And they will be interactive. If you ask the question to the parents about the child will be the first to answer. He will take the lead in many cases. Thereby, he establishes a personal contact, not only the physical contact by shaking hands, but also contact by verbal talk, contact through speech, contact through expression. So in such a scenario, you really spot the phosphorus child easily, as I have told in the above lines. One such case came to me few days back. The child, as he entered with his parents, was very bright looking. His eyes were shining, eyelashes were very long, and he was lean and thin child and fair colored. When I asked, "How are you?" Pat came the reply, "I am good. How are you, doctor?" And when I asked, "How can I help you?" he said, "I have come here with my parents." The child was 8 years old. He said, "I have come here with my parents to get my skin problem fixed." I said and asked him, "Where is the skin problem which is bothering you?" He lifts up his sleeve of the shirt and shows me his arm. So as I told you earlier, that these children are very expressive. And in phosphorus, the patient has a tendency to bear the part where the problem lies, to lift up the sleeve, to lift up the shirt in order to show you the proper place where the problem is bothering him or her. Because such a personality wants to establish contact, wants to bring everything to light, to knowledge, so that he or she can be helped properly. So I asked the question to the mother further, "How is he in the company of other children?" Mother said, "He is very easygoing, he is very lovable, he shares everything with the peers, and he is never a troublemaker." So when I asked the mom, "What's the report from the school? What the teachers say about him?" The mother said that teachers are very happy about him and his behavior. So the teachers say that he's very responsible and he is so intelligent that he talks more than his age. Such children who present themselves and who show their knowledge and who talk more than the children of their age, such children are called precocious children, intelligent children. So phosphorus children are also very precocious. They talk more than their actual age. So when I got up from my seat and I went up to my preparation area in the pharmacy room, the child quietly followed me. He stood by me, was watching my actions, what I was doing. Then he even asked me, "What is this medicine? How it looks like?" As he was watching me doing my stuff, doing my job, preparing remedy for him, he was looking around all my homeopathic medications lying around and all other files which were stacked in the cabinets. So he was so watchful and so observing. I gave him phosphorus 30 and the parents were requested to give me a phone call one day after as to how was the child doing. So the parents called me on the third day and they informed that the rash which the child had on his arm, that particular patch has stopped itching and the tone of the skin, of the color of the skin is also getting back. And thereby the child is not feeling any discomfort now. This was the case of the phosphorus child. It totally matched with the phosphorus remedy personality, and in homeopathy, this is the principle, like cures like. So what is this principle? The one which is responsible for creating a particular symptom or disease if given in a crude form has the power to treat the same kind of sickness or same kind of symptoms which it produced if it is given in a potentized form after preparing it according to homeopathic pharmacopoeia. So this was the phosphorus case. Now we will take up the case of the sulphur child. The sulphur child, in contrast to phosphorus children, are very strong in certain cases and are very robust, very extroverted, and they are very inquisitive and curious. They ask many questions. Sulphur has wonderful indications in pediatric age groups. Children are averse to taking bath, averse to washing. They look very dirty, dingy, and they do not make their hairs properly. They come to the clinic as they're sitting in their bedroom. Parents try to tell them that we are going outside, we're going to the doctor's office, we are going to the market. You just groom yourself properly, wear proper clothes, make your hair up. They will not bother at all. They will just start from their home as it is, as they are sitting in their bedroom or sitting in their living room. So these children are very poorly dressed and they are untidy, dirty in their appearance also. They can be either well nourished and they can be good built children also at the same time, and they can be thin constitutions and they can have pot type of bellies, means their bellies can be protruded in front. When they come to present themselves for remedy in the clinic, they have a tendency to touch everything. They have a tendency not only to touch, they can even throw things also around them, because these children are not organized. These children, they create a mess, and organization is not their part of the work. These children are also very, they boast. They feel that we possess more than others. So what is the possession of the children? In little ages, they play with their toys. The toys is their world. The toys are their wealth. So they will show their toys to their other friends. Oh, this is brought to me. This has been given to me as a gift by my mom, my dad, my grandfather, my grandmother, or any other relative. So they show their possessions. They are very showy. They want to convey this to others that we are very wealthy. I am very wealthy than you. I have these possessions which you do not have. And at the same time, they will never share their possessions. They will never let other children touch their toys. And when this dirty and filthy, untidy look is going on, what they do in the clinic, most of the time we see many children, they poke their fingers into the nose and they'll put the same finger into the mouth, which is very dirty. It looks so unhygienic at the same time. And when you probe it further, the parents tell, yes, he has this habit. Now he has done it in front of you. Maybe if he had not done, we wouldn't have shared it with you, because we do not know. Homeopathy can observe or treat such conditions also. And I put a question to the parents in order to just verify and confirm the remedy. I asked them, have you ever seen him poking his rectum with his fingers? They said yes. They rather asked me in return, how do you know? I told them that the remedy which is coming in the forefront has this trait in the personality of the children, because the children feel itchiness in the rectum and they have a tendency to probe it, to have it, to scratch, to itch it time to time. And I had also seen that the lips of the child were very red, bright red. When I told the mother, is this brightness of the lips always there, or it is there for few days? She tells me that not only his lips are red, we see that his anus is also very red. And the main complaints for which this child had come were his skin problems. He had eczema since as a child in his early age, right starting at the age of 6 months of age. They had applied hydrocortisone ointments from time to time, and for a little period of time when the hydrocortisone ointments were applied topically, there was some respite, there was some relief to the child. But when the action used to wean away, then the itching and scratching used to return again, thereby causing more discomfort to the child. So this was going on back and forth for 2 2.5 years. When the remedy was in the forefront, I explained to the parents that this remedy, which has come into the selection, has its action as a centrifugal action. So what is centrifugal action? Centrifugal is from in to out, and homeopathic remedies, when they are given as a simillimum on the principle like yours like, they have a tendency to express the one which is suppressed. In the case of the children and even in adults, where we use the topical hydrocortisone ointments, the disease which has been thrown out onto the surface by the immune system, we throw it inside the system again. We push it back inside the organism by applying the topicals, suppressive topicals. So in such cases, when the proper simillimum is given, the skin has a tendency to express itself. So I had explained it to the parents. If after the remedy there is a flare-up of the skin problem, don't worry, that will be a temporary state and it will go away by itself. So I gave the remedy Sulphur 30 in a single dose and requested the parents to give me a call after 1 week of the use of the remedy. So the remedy was given and the parents contacted me after 1 week, and they reported that the itchiness of the skin on all the parts of the body where it was affected has gone away. The color of the skin is coming back. The child is not itching or is not scratching his skin as he used to scratch intensely earlier. That has gone better. And he is not poking his nose with the fingers at all. He is not probing his rectum also at the same time. And we see that his appetite has also improved. His temperament is also better from earlier. Now he shares his stuff with the other children. So this is the power of homeopathy. If a right kind of simillimum is given, it shows its results quickly. So today we have tried to give you the picture of the remedies as you can see them in a clinical setup in children. We'll be coming up with more such videos, how to recognize the children belonging to certain other remedies or other group of remedies. Please do not prescribe these remedies which I have just shared with you on your own level, because only a professional homeopath can decide about the dosage and the proper remedies depending upon the severity of the sickness. If you give the remedies on your own level, they might not work in the same way as they are handed out of the clinic of a professional homeopath. So please do not medicate on your own level. Thank you for listening. We will meet you again with another video on the diseases of children. Thank you very much for listening. Thanks.